Hi guys, it's me, Professor D, and welcome back to my YouTube channel. Guys, on this video, I'm going to go over fluid and electrolyte imbalance. Here's what's so crazy. This is going to be part 1, even though part 2 is already loaded, okay? So here's what happened. I did a fluid and electrolyte imbalance video, and I thought I did one before, so I just named it part 2, and apparently there was never a part 1. Sorry about that. So it's about a year later, and here I am. I'm making the part 1. I'm so sorry, guys. I don't know what happened, but better later than never. And guys, by the way, it doesn't matter if you watch this first and the other one or the other one than this. There's no chronological order. It's just information that's very important for you to know. Okay, guys? So one more thing I want to talk to you about before I jump into this video. If you haven't done so already, please do not forget to like and subscribe below, guys. That is what will eventually help me get to the point to making these videos for you all day, every day, right? But until then, guys, I'm asking you, please help my channel grow. If I'm helping you, please help my channel grow by supporting me. How can you support me? Share my videos on your social media with family members, friends who are in the nursing program or you think may want to be in the nursing program, or anyone you know studying for your boards. I lied. There's one more thing I want to talk to you about. Do not forget, guys, I'm also on TikTok. I'm on Instagram. I'm on Facebook. Okay. And the material that I cover here on YouTube is different than what I cover on my other platforms. So be sure to check those out as well. I have more resources available on my website. You can check me out at nexusnursinginstitute.com. Okay. Without further ado, now let's get started. First question. Why do older adults generally have less body water than younger adults? A, as functional cells die during the aging process, less water is needed. B, the muscle mass of older adults is smaller than the muscle mass of younger adults. C, older adults have a smaller extracellular fluid to intracellular fluid ratio than younger adults. Or D, the plasma volume of older adults is decreased due to reduce the size of excess fluid volume in heart failure. And guys, the correct answer is B. The muscle mass of older adults is smaller than the muscle mass of younger adults. And guys, here's the thing. Those muscle cells hold lots of water. So it makes sense that the smaller mass of muscle cells you have, the less water you're going to be able to hold on to. And guys, as the adult gets older, the muscle mass becomes less. So that is the correct answer. Next question. When evaluating the hydration status, the nurse observes tenting of the skin on the back of the 87-year-old's hand when testing skin turgor. What is the nurse's best action? A, notify the physician. 2, examine dependent body areas. 3, assess turgor on the client's forehead. Or D, document the findings as the only action. And guys, the correct answer is C, assess turgor on the client's forehead. So whenever you're checking turgor on an older adult, you want to do it on the bony prominence, guys. You want to do it on a bony prominence such as the forehead, such as the chest. Why? Because there are no wrinkles there. That's the whole point, because you're checking for turgor, and if you see the skin tense, but the patient has wrinkles, okay, is it really tenting or is it wrinkles you're dealing with? You want to do it on a bony prominence, such as the forehead or the chest, so that you can get the true reading of that skin turgor, okay? So that's why C is the correct answer. Now let's look at the wrong answer choices. A, notify the doctor and tell the doctor what? Tell the doctor what? You haven't even done an assessment, right? So that's wrong. B, examine dependent body areas. That doesn't give you that patient's true status when you're checking skin turgor. And D, document the find. Oh, ding, 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 only. What did I tell you about all-inclusives? Didn't I tell you all-inclusives such as only, always, never, to only choose them when you know that you know that you know that you know that's the answer, right? I told you that. Well, we know that's not the answer because it's wrong. So you should not have chosen that. Be very careful, guys. When you see all-inclusives, don't pick that as an answer choice unless you know beyond the shadow of a doubt that that is the correct answer. So, guys, the correct answer is C. Next question. What effect would an infusion of 200 milliliters of albumin have on a healthy client's plasma osmotic and hydrostatic pressures? A, increased osmotic pressure, increased hydrostatic pressure. B, increased osmotic pressure, decreased hydrostatic pressure. C, decreased osmotic pressure, increased hydrostatic pressure. Or D, decreased osmotic pressure, increased hydrostatic pressure. And guys, the correct answer is A, increased osmotic pressure, increased hydrostatic pressure. Okay, so let me explain this to you. First of all, we're talking about albumin. Albumin is a part of the blood, but what kind of part of the blood is it? It's a protein, okay? It's a colloidal substance. And guess what? When you add albumin, the osmotic pressure is going to be increased. Why? What does albumin do? It pulls the fluid and keeps it there. So what happens is when you put that albumin into the blood vessel, right? It pulls fluid into the vessel and it keeps the fluid into the vessel. It keeps that fluid from leaking back out. That's why patients who's had major burns, right? Lots of times they'll get albumin because patients who have major burns, they'll go through a fluid shift. And that patient will be dehydrated because all of the fluid that were in the vessels are now out in the tissues. And something like albumin, which is a type of protein which will increase osmotic pressure, will pull all of that fluid that leaked back into the tissues and it'll pull it back into the vessels where it belongs. That's why when a patient has hypoalbuminemia, which means they don't have enough albumin in the blood, what we tend to see is they also tend to be dehydrated because all of the fluid that was in the blood vessel, because the albumin was keeping it there, because the albumin's low for whatever reason, the fluid's like, woohoo, party time. There's no albumin here to keep us in the vessel. Let's ditch this joint. And all the fluid goes into the tissues, okay? So this is absolutely true. Increased osmotic pressure, it pulls it and keeps it there, and increased hydrostatic pressure. Think about it, guys. The more fluid that's in the vessel, that's more pressure that's being pushed against the vessel wall. So A is the correct answer, guys. Next question. Which community dwelling healthy person has the greatest risk for dehydration when exposed to a hot, dry environment for several hours? A, 50-year-old man. B, 50-year-old woman. C, 80-year-old man. Or D, 80-year-old woman. And guys, before I tell you the answer, I want you to think about this. This is where your critical thinking comes in. Basically, they're asking us who's more likely to be dehydrated, who's more likely to have fluid pulled from them, right? And remember in the first question, I told you the person that has the most muscle mass will hold on to the most amount of water because those muscle cells hold on to fluids. So think about who would have the least muscle cells that would be holding on to the least amount of fluids. Think about it. The older that you get, the smaller those cells become. They don't die off. They just get smaller, number one. The mass becomes less. And number two, they become smaller. Guess what? That's less capacity that they have to hold on to fluids. Generally speaking, okay, guys, generally speaking, who will have more muscle mass of the same age? If you take a 30-year-old man and a 30-year-old woman, who will have more muscle mass? The man will have more muscle versus fat, and the woman will have more fat versus muscles, okay? So we already know, before we even look at our list, right? If we're looking for the person who's going to be holding on to the least amount of fluid, we're going to be looking for a female, right? And we're going to be looking for an older female because we know that as that female gets older, the muscle mass is going to be less, which means she's going to be holding on to less of that water. So who's going to be our answer? D, the 80-year-old woman. One 50-year-old man, more muscles. B, 50-year-old woman. Okay, she's a woman, but guess what? We have an older woman, which is our D, and that's why that's our answer. And again, C, 80-year-old man. Guys, please don't be leaving any crazy comments in my comment section about this. If you have a problem with it, please go argue with your textbook. Don't argue with me. I'm just trying to help you pass your next exam, okay? All right. Okay, guys, next question. The client's serum sodium level is 128 and serum potassium is 2.8. Which hormonal problem is most likely to have caused this clinical situation? A, increased aldosterone secretion, B, decreased aldosterone secretion, C, increased ADH secretion, or D, decreased ADH secretion? And guys, the correct answer is C, increased ADH secretion. What is ADH? Anti-diuretic hormone. It's a hormone that makes you what? Not urinate, makes you hold on to all of your urine. And so what happens is you're holding on to all that urine, you're holding on to all those fluids, those electrolytes, those solutes that you have, they get what? Diluted. And so we'll see that potassium and the sodium, we'll see it do what? Go down, because it's diluted because of all the fluid. And that's exactly what we're seeing happen. Sodium, guys, is supposed to be 135 to 145. This patient's sodium is 128. Potassium is supposed to be 3.5 to 5. This patient's potassium is 2.8. Okay? So what happens, the patient's holding on to all this fluid and it's being diluted. Okay? Now let's look at the wrong answer choices. A, increased aldosterone secretion. If this patient, in fact, had increased aldosterone secretion, we would see the sodium go up and the potassium go down, right? Decreased aldosterone secretion. In this case, we would have seen the opposite. We would have seen the sodium go down and the potassium go up. And last, decreased anti-diuretic hormone secretion. With this one, the patient would lose their fluids, but guess what they're holding on to? The solutes / what? Osmolality, okay? So that's why, guys, C is the correct answer. I need to get a new stand. Okay. What problem is likely to occur when a client's fluid intake is so low that his or her urine output is less than 400 milliliters per day? A, cellular swelling and subsequent edema. B, reduced excretion of body waste, especially nitrogen. C, expansion of interstitial volume with reduced plasma volume. Or D, dilution of serum sodium levels to the extent that excitable membranes can no longer depolarize. And guys, the correct answer is B, reduced excretion of body waste, especially nitrogen. Okay, guys, so patient at the minimum, they're supposed to be urinating at least 30 mLs per hour. We expect for the patient to have about 4 to 600 milliliters per day at the minimum, okay? What happens if they're not producing that? Well, think about the job of the kidneys. So you eat all these foods, your body breaks them down, your body produces all of this waste, right? Nitrogenous waste. Well, what your kidneys do is help to filter those wastes and turn those wastes into what? Urine. And then you get rid of that urine through the bladder and you urinate. But if for whatever reason, you're not getting an adequate amount of fluid intake, for whatever reason, your urine output goes down, that means you're what? You're going to be dehydrated. I want you to think about this, guys. Your body is meant to survive no matter what, okay? So you think if you're losing these fluids that you need, what do you think your kidneys are going to do? They're going to shut down because your body's trying to protect itself. Your kidneys are saying, whoa, I don't know what's going on, but I'm going to go ahead and hold on to the little bit of fluid that I have left because I don't want Professor D to die, right? Your kidneys are going to shut down. Look at B, reduced excretion of body waste. That body waste is where? In the urine, guys, especially nitrogen. Those are the wastes that were in your blood that now has turned into nitrogen and is going through the urine to be excreted, okay? Now, choices A, C, and D are absolutely wrong. What we will see in this kind of situation where the urine output is less than 400 mLs per hour, and when you see the urine output this low, something's going on that this patient does not have enough fluids and the body's trying to hold on to what's left, okay? So the kidneys shut down. You see urine output down. GFR down. BUN up. Creatinine up. Why? Kidneys are in trouble some way, somehow. Kidneys are saying something is wrong and you need to figure it out. Okay? Next question. Why is it important to keep the sodium level of the plasma volume so much higher than the sodium level of the intracellular volume? A, intracellular sodium is toxic to living human cells. B, excess sodium displaces oxygen on the hemoglobin of the red blood cells. C, high plasma levels of sodium are needed to balance the high plasma levels of magnesium. D, excitable membranes are dependent on sodium concentration differences for depolarization. And guys, the only correct answer here, guys, is D. Excitable membranes are dependent on sodium concentration differences for depolarization. Let me tell you something. If the sodium concentration was the same in the extracellular fluid and the intracellular fluid, there would be no depolarization. Okay? How are your muscles going to move? How are nerve impulses going to happen if there's no depolarization? That's why it's so important. So there must be a difference in concentration. There must be that gradient. Okay? D is the correct answer. What is the nurse's best action for the client whose serum chloride level is 101? A, document the finding as the only action. B, assess the client's deep tendon reflexes. C, urge the client to drink more water. Or D, notify the doctor. And guys, the correct answer is A, document the finding as the only action. Well, I know what you're thinking, Professor D, you just told me to never choose an all-inclusive such as only, always, never, unless you know that you know that you know that you know that's the answer. But guess what? For this question, we know that we know that we know that's the answer choice. Guys, look at it. They're talking about serum chloride. What's your normal level? About 98 to 106. This patient's 101. There's nothing wrong. There's nothing wrong. So we're just going to document this as the only action. And whenever you see an answer choice of document this as the only action, you only do this when everything is A-okay. And everything's fine in here. Okay? Assess deep tendon reflexes, urge the patient to drink more water, notify the doctor. All of those you do if something was wrong. There's nothing wrong. The sodium chloride is well within the normal limits. By the way, guys, if you see the sodium chloride, if it's high, it may mean that the patient has dehydration going on. If it's low, it might mean the patient may have some kind of cardiac issues. Either way, high or low, it needs to be investigated further. But this patient's chloride level is within normal limits. Which statement by the 74-year-old client should alert the nurse to the possibility of fluid and electrolyte imbalance? A, my skin's always so dry, especially here in the Southwest. B, I often use a glycerin suppository for constipation. C, I don't drink liquids after 5 p.m. so I don't have to get up at night. Or D, in addition to coffee, I drink at least 1 glass of water with each meal. And guys, the correct answer is C, I don't drink liquids after 5 so I don't have to get up at night. This patient is restricting their fluid intake. 5 p.m.? They're restricting their fluid intake, and patients who restrict their fluid intake, they're at risk for what? Dehydration. Especially older adults. This patient's 74 years old. Now, we don't want the patient drinking, 9 o'clock at night, but 5 p.m., no, they're restricting fluids. And remember, guys, the older adult not only has their muscle mass decreased, so they're not holding on to as many fluids as they used to. What do they tend to lose? Their sense of thirst. That's why you have to always remind them, oh, Mr. Such and Such, don't forget to take a sip of water, because they just don't get thirsty. So they're already at risk for dehydration. And now they're putting themselves on fluid restriction? No. By the way, just so you know, when a patient does something like this, and what does it say? I don't drink liquids after 5 so I don't get up at night. Okay. So when a patient does this and they're restricting their fluids, what that does is it concentrates those solutes in the urine, and that causes irritation to the bladder, which will make the patient want to do what? Urinate. All right. So what do? You teach the patient, well, about, an hour before bed, you want to stop drinking liquids, because if that is a concern, okay, we can understand that, but not this early at 5 p.m. Okay. If the patient's restricting their fluids that long before bedtime, they may be doing a disservice to themselves because, like I said, they're restricting their fluids. Those solutes get concentrated. Those concentrated solutes irritate the bladder, and it's a vicious cycle, okay? And that irritated bladder is going to make them want to urinate, okay? So it defeats the purpose anyhow. Next question. Okay, guys, if you've been following me for any amount of time, I know you're going to get this one right. Easy peasy. Clients receiving 150 milliliters of 5% saline intravenously, excuse me, guys, in the next 2 hours, what response should the nurse expect as a result of this therapy? A, increased blood pressure. B, increased dependent edema. C, increased urine concentration of potassium. Or D, increased H&H, hematocrit and hemoglobin. And guys, the correct answer is A, increased blood pressure. It just says in this question, guys, patients getting 150 mLs of 5% saline going where? Within the vessel. I just talked to you guys about this a few questions ago. The more fluid that goes inside of a vessel, the more pressure that's being exerted against the vessel walls. The more pressure that's being exerted against the vessel wall, what do you think high blood pressure is? That's what it is, hypertension. So, you know, the more fluid, we expect that blood pressure to go up. That's why if patient's blood pressure is very low, we're worried about that patient going through shock. What are we going to do? We're going to make sure that we get fluids within the vessel to what? Bring up their blood pressure. That's why A is the correct answer. Now, B, increased dependent edema. That could be cardiac issues. It could be lots of things, right? But we don't expect to see that if we give that patient the 150 mLs of normal saline. C and D, the increased urine concentration and the increased H&H, we expect to see that in dehydration. But we don't expect to see the patient having those signs and symptoms of dehydration if we're putting fluids within the vessels. What we expect to see is one, an increase in the patient's blood pressure. Which protein source should the nurse recommend for a client who needs to restrict dietary potassium intake? A, raw broccoli. B, grilled salmon. C, poached eggs. Or D, baked chicken. And guys, the correct answer is C, poached eggs. So guys, key word, they're looking for what? Protein source. Protein source, but also low in potassium. Well, meat and fish, they are protein sources, but they're also high in potassium. But eggs are a protein source, but they also happen to be low in potassium. That's why we're choosing C. Look at A, guys. A's high in raw broccoli. That's high in what? Fiber, okay? That's not a rich protein source. That's a rich fiber source. So our correct answer is C, poached eggs. Which dietary supplement should the nurse suggest to the client who needs to increase his or her intake of calcium? A, vitamin A, B, vitamin B, C, vitamin C, or D, vitamin D. And the correct answer, guys, is D, vitamin D. So they're asking us about calcium. Well, calcium, we know calcium is good for bone health and bone growth and to make the bone nice and strong so it's not porous so the patient doesn't have osteoporosis. Great. But guess what? Vitamin D is what helps you absorb the calcium. So what's the point of taking all this calcium if you can't absorb it through what? Your GI tract. Vitamin D is what helps it be absorbed. Excuse me. Now let's look at the wrong answer choices. Vitamin A, that's really good for vision. Vitamin B is really good for like energy, metabolism. Vitamin C, wound healing, right? Tissue repair. So the correct answer for this question, guys, is D, vitamin D. Which electrolyte should the nurse most closely monitor in a client who has decreased parathyroid function? A, sodium. B, potassium. C, calcium. Or D, chloride. And guys, the correct answer is C, calcium. If I've said it once, I've said it to you a million times, guys. When it comes to your thyroid gland, you're going to think of metabolism. energy. But when it comes to your parathyroid glands, you're going to think of calcium. Calcium where? In the blood. So if the patient has hyperparathyroidism, their calcium is high in the blood. If they have hypoparathyroidism, the calcium is low in the blood. Okay? Next question. Which intervention is most important for the nurse to teach a client who has lymphedema in her right arm from a mastectomy 1 year ago? A, exercise your arm and use it during tasks that occur at the level of your chest or higher. B, be sure to use sunscreen or protective clothing to reduce the risk of injuring this arm. C, reduce your salt intake to prevent excess water retention. Or D, do not expose the right arm to temperature extremes. And guys, the correct answer is A. So this patient had a mastectomy a year ago and now they have lymphedema, right? What do we want them to do? We want them to move the muscles, contract the muscles in that area, right? And keep that arm elevated. Why? We want gravity to help. First of all, when they're moving that muscles in that area, when they're using the muscles in that area, the contraction of that muscle will help fluid to shift. And it will help fluid to move. And when that arm is elevated, it helps fluid to what? Drain. We want gravity to help us, and that's why A is the correct answer. By the way, that's a famous test question on NCLEX. Which assessment finding obtained while taking the history of an older client should alert the nurse to the possibility of fluid or electrolyte imbalance? A, I'm too cold and need to wear a sweater even when other people are warm. B, I seem to urinate more when I drink coffee. C, in the summer, I feel thirsty more often. Or D, my rings are tighter this month. And the correct answer is D, my rings are tighter this month. All right, guys, so let me ask you something. What's more likely? The ring shrinking or the person's finger swelling up? The person's finger swelling up, right? So that is the correct answer. That is correct answer. Why are their fingers swelling up? Maybe the patient's holding on to too much sodium. What does sodium pull? Water, fluid, right? And so now this patient has fluid overload, that finger swollen up, they can't get the ring off. Now let's look at our wrong answer choices. A, I'm often cold and need to wear a sweater even when other people are warm. That could be many things, but not fluid imbalance. It could be maybe the patient's anemic. Maybe they have hypothyroidism. It could be a number of things. B, I seem to urinate more often when I drink coffee. Well, duh. Coffee is a bladder irritant. You should feel like you need to urinate more when you drink coffee, right? C, in the summer I feel more thirsty. Well, duh, because in the summer it's hotter. So your body's going to require more fluids. So the correct answer here, guys, is D, my rings are tighter this month. I doubt that all of this person's rings have shrunken. No, their fingers have swollen up. All right, we are down to our last question, guys. The client at risk for dehydration is on strict INO. In addition, the client has a large draining wound. What action should the nurse take regarding fluid loss through wound drainage? A, no action needs to be taken because wound drainage is considered insensible loss and is of no consequence. B, estimate the amount of wound drainage by the color of the stains on the dressing. C, weigh the dressing materials before and after the dressing change. Or D, weigh the client before and after the dressing change. And guys, the correct answer is C, weigh the dressing materials before and after the dressing change. We want to know about the wound drainage and its weight. By the way, guys, when you're weighing that type of drainage, so 1 milligram is equal to 1 milliliter, okay, of body fluid. Let's look at the wrong answer choices. A, no actions needed. Well, yes, an actions needed. They just told you that we have to do strict, not just INOs, strict INOs. That means we need to know everything. We need to measure everything. So A is wrong. And then let me keep going to A, because look at the end. And is of no consequence. Let me tell you something. Oh my gosh. I just realized that, I'm so sorry, guys. I just realized that the jacket I'm wearing, hopefully you can't see it. Never mind. Okay. Back to what I was saying. Of no consequence. Don't ever choose the answer choice that says it's not a big deal. Because in A, where it says it's of no consequence, that's another way of saying it's not a big deal. Everything is a big deal in NCLEX. If something's wrong, it's a big deal. Okay? So don't ever choose an answer. There's a difference between nothing being wrong, and so you're just going to document because nothing's wrong, and something actually being wrong, and you saying, oh, something's wrong, but it's not a big deal. Don't ever do that. So A's wrong. B, estimate. Did that question just tell us strict INO? So how are we going to estimate when they want strict INO? They want us to measure everything. So no, we're not estimating anything. That's wrong. D, weigh the client before and after the dressing change. Guys, we want to measure what? The drainage, to include that in the INO. Okay, so you're not going to be measuring the patient when the question's asking us about the drainage. What you're going to do is you're going to weigh all of, your gauze, everything you used on that patient. You're going to weigh it before you put it on the patient, and then afterwards, so you can find out how much they truly lost. And don't forget, guys, when it comes to body fluids, 1 milligram equals about an ml. Okay, guys, I hope you found this video to be helpful, and I'm so sorry it took me so long to come up with a true part 1 for you. But my list from you guys just keeps getting longer and longer of the videos that you want to see. So I've been trying to make newer content for you before I went back to this, because at least I covered some of it. So guys, this is your part 1. If you want to see more fluid and electrolyte imbalance, please do not hesitate. Let me know in the comment section. Or if there's something else you want to see me cover, let me know in the comment section, guys. Please go ahead and help out my algorithm with YouTube. Say hello to me in the comment section. Don't forget to share my content with your classmates. Oh, guys, thank you so much to all the instructors who are playing my videos from California to Oklahoma. I got instructors playing my videos in Canada, in Australia, Scotland. I can't believe it. Thank you so much. Thank you, thank you, thank you. Guys, don't forget to check out my content on nexusnursinginstitute.com. Don't forget to check me out on my other social media platforms, TikTok, Instagram, Facebook. And please, guys, do not forget to like and subscribe below. And you'll be seeing me on the next video.